So good afternoon, everybody. Thank you so much for investing your time with us this lovely Friday afternoon, ready for the weekend. We're happy for you to take part on our 5th series from the ground up. My name is Maria Fuertes, and I am the director of the Practice Heroes program at CareStack. Today, we have Ruben Camp, who will be speaking on improving the patient experience and case acceptance through technology. Ruben leads Dark Horse Tech, an IT firm that serves 850 clients in 48 states. That's a lot of states, Ruben.
49.
Yeah.
I got Mississippi.
All right.
There you go.
Utah still hates me for some reason. I don't know why.
Oh, they'll come to love you. Yeah. So 48 states, by offering them advanced and secure IT solutions. And Ruben, he'll be providing valuable insights on where to begin or assess everything you need to know when opening up a practice from the ground up. So our goal today is that you will come away with an understanding, knowledge, and pearls of wisdom, if you will, that you can apply to be more successful in your business. So here's a format to give you an idea of what to expect today. We'll take a few moments from each of our speakers to briefly introduce themselves and tell a little bit about their background in the industry. Nicole will kick it off the conversation by highlighting today's topics. I've been in a conference, guys, and I've been talking to mostly everybody in this ballroom, as well as addressing some housekeeping information. And towards the end, we'll open it up for questions, which you can enter into the chat box below. We want to give you an opportunity to ask specific questions that you've been thinking about to help you navigate the challenges in opening up a practice. And don't forget to stick with us to the end to get that code for your $25 Grubhub. So sounds good? Great. So let's get started with the introduction. Ruben, thanks for being on our From the Ground Up series, and tell us a little bit.
Of course. I am the son of a dentist. That's how I got into this crazy industry. Thought I wanted to be a dentist and pulled back about junior year of college. I went to Carolina. After college, got a job at Benco. So I've always loved IT, and I had some connections, obviously. My dad's Benco rep offered me a job. So that's how I got a job there. Worked at Benco for a few years, started Dark Horse to really focus on more of a customer experience, white glove IT, still dental. And we've been around for almost 10 years now. At the beginning, it was mostly supporting existing practices. And that's still a big part of what we do today. But in recent years, I'd say in the last 3 or 4, has really, our company has grown in the de novo startup from scratch and new practice acquisition and kind of renovation side of things. So, what I'm going to bring to the table today is, right now, near the end of 2020, we work with 100, we open 100 startups a year. So wow. These are, and not everyone says yes, believe it or not. I mean, it's what's not the like, but that's 100 people that liked our vision, like what we bring to the table. We have it's very patient centric. And I think that's why you guys wanted me on here today, is because IT is like a little bit of what we talk about it sounds crazy, in the IT plans for an office. It's really about workflow and patient experience, and a computer's a computer and anyone can sell one of those. So it's about how do we leverage technology so you can run a very successful practice, and that's what I'm going to try to do today.
Yeah, no, and as Maria said, thank you for being here. And for anyone who is joining that does not know me, I feel like I am on every call these days, but my name is Nicole Perry. I'm the Senior Account Executive here at CareStack. I've been with CareStack since 2018. And Ruben, it sounds like we have more in common, because the way I found CareStack was I was actually interviewing with Benco at the time and came across CareStack, and that's how I ended up here, luckily. So hello, everyone. And again, thanks for joining us. Your cameras are turned off intentionally, and your microphones are also on mute intentionally. So if you do have any questions, please feel free to put them in the chat box or the Q&A. As Maria said, we'll tackle those as we go through today's presentation, wherever we see fit, or at the end, we can do a live Q&A with Ruben. But with that being said, we'll jump right in and we'll look at today's topics. So today, Ruben is joining us from Dark Horse, and he'll be talking about patient experience, configurations and setup, and entertainment extras. So Ruben, I'm just going to kick it right over to you, and you'll start with patient experience on how to build it from the ground up.
Let's do it. So yeah, from the ground up, sounds like a startup. So I'm going to be pretty comfortable here. So, you know, when we talk about starting a plan with an office, this is really, you know, you can go through a checklist. Yeah, I want to use Open Dental. I want to use CareStack. Of course, you're going to choose CareStack because you're on this call. What practice, you know, what imaging software, CBCT. All right, those are very just checklist items. What we really care about is how the patient feels when they walk into your office, how they feel when they're brought into the treatment room, how they feel while they're in the chair, how they feel after the procedure is done in the handoff to the front desk, and do they feel very happy leaving you a Google review on the way out. So there's a lot of different ways we can address the patient experience. And of course, I'm going to come at it from the technological standpoint. So let's say, you know, before the patient even walks in the door, you guys are using CareStack. You can make sure all their paperwork is do we even say paperwork anymore? I mean, I feel like we can end it on this call. There's a digital form that you can fill out that stays digital, doesn't get transferred to paper, and is waiting for you in the patient's document center, you know, as they come in, right? So there is not this, you know, experience where we're talking about papers and scanners. Like, this is a completely digital workflow. So you're prepared, you're ready to go, you know. And, you know, when we're talking about, you know, first things first, a lot of our clients are going to what almost like a spa menu. Now, if you see the picture in the middle, that's La Lux, Dr. Ashley out of DC. She opened last year. And as you walk into her treatment room, you'll see her logo. You'll see "Welcome to the practice, Nicole," right? They customize the message to the patient. And then they give them a list of heated blanket, you know, there's the neck rest there, like you're on an air flight. They really focus on making sure the patient is in a really comfortable place, right? And I think about my dad's practice growing up, no technology, right? It is, I played hockey, so I've had some work done. If I got a tooth knocked out, I'm like picking out patterns in the ceiling tiles to try to keep myself entertained throughout the procedure. Like, this is not a very fun mental experience. You know, being upstairs in your head for an hour is scary sometimes. So, you know, getting the patient in the right mindset, getting them comfortable, these are all things that are going to lead to increased cases acceptance. It's going to lead to them referring their friends and family. It's going to lead to, maybe the most important thing, them leaving you a review, right? And that process is all driven through the software stack inside of CareStack, right? You don't have to go outside. If that patient is in a really good mindset, you know, definitely leverage the software to strike while the iron is hot, right? Every minute they're outside the office and the kind of the effect of this wonderful experience you've put on as worn off, the less likely they're going to be motivated to leave that. So just, and I know I touched on a little bit earlier, but the handoff, and that's why the handoff is so important, right? You have the waiting room experience, they feel comfortable, you bring them to the chair, let's say you gave them the spa menu, right? You did a great job on the procedure. You identified some treatment that needs to be done. You talk to them about, yeah, we're ready to go. But if the communication is not upheld from the chair to the front desk, right, that handoff doesn't happen, then everything you just built falls flat. So it's, you know, it's like that old saying, what makes a good story? You know, get a great beginning and a great ending and get them as close together as possible. So same thing here, right? It's that's what they're going to remember. They remember that first you know, experience, and then how is it handled at the end. So really focus on those things. Where we see, you know, technology coming into play, you know, I mentioned staring at ceiling grid. It would have been great to be able to watch, let's say, the new season of Narcos that just came out, all right, and not really think about the Septicane and how many vials I needed to get numb today and everything that's going on in my mouth that I don't want to think about. So Dentistry, it's, as we all know, this is some place where people don't want to go, right? And it is our job to make this a hospitable, warm, welcoming place. So we have our work cut out for us from the get-go, right? We're not running a bar, a dispensary, someplace where people are just coming in like, let's go. You gotta get them there. So, and I'll start the left. That's Dr. Stephanie Mint Hill Smiles, right outside of Charlotte. She went full breakaway style, right? So she came, told me exactly what she wanted. This includes 2 screens at the 12 o'clock, 2 TVs at the toe of the chair, and a ceiling TV. Now, it's really important to think about why we do that. And it's an efficiency thing, right? It's also efficiency, I would say also patient experience, right? So if we have CareStack on the left screen, we have imaging on the right, now we don't have to waste our time turning back around to see, hey, where is that screen? Is the patient seeing? Everything is duplicated on that imaging screen to one of the TVs. And then they have entertainment options on the other TV. They also sometimes use it to announce like things they've done in the community, highlight staff members, whitening specials, whatever they want to do. And then that entertainment TV is then mirrored to the ceiling TV. So when you're ready to start working on the patient, they can be reclined and right where they left you. There's no like play, pause, where were you? It's this exact same feed, wireless headphones, great experience. They took it up another notch. They backlit their TVs, they dim the lights, they're really into this stuff. And they have already doubled their treatment rooms since they opened. So whatever they're doing is working very well.
That's what it looks like, Ruben. I mean, like coming from, the dental practice as well. I just remember walking into the operatories way back in the day, where was the box TV, hanging on.
It's like a CRT monitor with like a seatbelt strapped on.
I just remember those days. So like kudos to the doctor there in North Carolina. That's amazing. Yeah,
she knew what she wanted, and then she even took it up a level. The backlighting, I can't take credit for that. That was pretty amazing there. Now, we talked about the one I wanted to highlight Ashley's practice, because I think she does a really good job using, honestly, Microsoft PowerPoint. That's how she customizes that screen. If it's a new patient experience, we're talking, if you walk into a treatment room and it's like a customized message and a spa menu, like that's pretty awesome, right? It feels really personalized and a very unique experience to them. Obviously, behind the scenes, your staff is opening up a PowerPoint, editing the name for this next new patient, and then getting it ready, right? It's a very procedural thing in the background, but structure like that is what leads to quality, right? Repeatable structure. So the one all the way to the right, this is more of a typical pediatric setup. So you'll kind of see like a floating 12 o'clock here. And I kind of wanted to talk about this picture in that pediatric, I don't know how many of you either run or been in pediatric offices. I've been in a lot. It is chaos. Like people are running around everywhere as kids screaming, like it is a war zone in there. And when we talk about TVs and like kids having choice, no, we can't do that, because we're just now wasting time, right? That's creating even more chaos. So what we tend to do is, yes, we do put those TVs, sometimes in open bays, we'll get creative and we'll put them on the ceiling or the wall, depending on what's the best viewing angle. But we literally duplicate one stream to every single TV, right? This kid sits down, Frozen's playing, we're good. We don't have to stop and fight about which TV show we're watching. They have something to distract themselves, and boom, we're going forward.
So what you're saying is there's no Narcos playing for children.
You get a reputation, probably not the one you want.
Yeah, probably not. That's fair to say. I mean, I think you touched on a lot of like the treatment rooms, the tech experience that people can have in a practice. I mean, what would you say like the most common TV configurations would be for a dental practice as well? I mean, I know you briefly touched on it, but what are you most commonly seeing? Because I know you've given a few options.
Yep, most common, I would say single 12 o'clock monitor. you'll run an this would be the one to the left that I'm going to talk about. They got fancy with doing the breakaway cloud and all that stuff, but same concept. One monitor at the 12 o'clock mounted, running your practice management software. There's an HDMI cable running. You don't see it. That's on purpose. To the TV at the 6 o'clock wall. That is really where the imaging software lives. You know, Soda or Tiger View. And then the ceiling TV is exclusively for entertainment, right? We'll have a wireless headset. You'll see that highlighted in Dr. Horowitz's office all the way to the right. She's awesome to follow on Instagram because she gets like Cody Rigsby from Peloton and Dancing with the Stars comes to her practice and like blows her up all the time. It's awesome. So she's a really great follow. But these are things like we talk patient experience aside, let's get some good reviews and let's get some new patients in the door. There's like, let's say a patient's looking for an office to go to. If I know I can come in, wireless headphones, like it's going to set you apart from the other offices in your area, right? To be able to, and don't hold this information to yourself. Let everyone know that this is happening, right? This is a way to attract patients to your practice. Another unique configuration you'll see in the top middle there. My buddy Bill runs a practice in Kansas City called Mission Dentist. Really cool. This is the old NCAA headquarter building. He took over for his father's practice. Really great operation, about 18, 19 operatories there. And
wow. Beautiful view too.
Oh, great view of like Overland Park area. It's on the 3rd floor, so he's got some great views there. And you know, when I was talking about Bill about designing this practice, you know, the way he sells treatment, wants to sell treatment is he wants that screen to be as close to the patient as possible. So it might not be really easy to see, but that is actually an ICW mount coming from the ceiling. We worked with the general contractor to make sure there's electrical and backing up there. And obviously an HDMI coming down through. But he wants the patient experience not to be across the room on a TV 8 feet away. He wants to like be bedside manner, cozy, like, hey, this is what we're talking about, maybe hand on the shoulder, you know, stuff like that. And that's the way he best connects with patients and gets them to, you know, believe is one word, but actually be like, yes, I'm going to schedule that appointment to get that work done.
So Ruben, we just got a question that came up. What are 2 to 3 must-haves? I know we're talking about the operatories, but what are the 2 to 3 must-haves in creating the best reception area for patients?
Yeah, so you know, we used to think, you have to have guest Wi-Fi. Those days are kind of over. Everyone's got a phone with an LTE or 5G plan, so having guest Wi-Fi not as important anymore. The best things I like to see, if your practice does see children, having there are options. Kids Space is a company out of Canada that makes some really cool products in the entertainment space. There's another one that's a little more custom, but it involves a projector shooting down at the floor, and it's got some really fun experiences there. But kind of kids aside, definitely have a TV, right? You're like, and that TV needs to align with what kind of experience you want your patients to have, right? If you are just going tranquility, like calm, settle the nerves, planet Earth, fly over America, just put something on there that makes people feel okay, right? Calm and ease. And, you know, so that's one way to approach it. The other way is if you really are, you know, wanting to highlight, you know, let's say you're big in the community, right? And you're very charitable, and you spend a lot of time giving back, and you want to make sure your patients know, you know, that you're a good human being. That TV can be a highlight of what you're doing for the community. It can be a highlight of procedures that you do before and afters, great outcomes that patients have had. Obviously, follow HIPAA laws and make sure there's no patient health information anywhere there. And then I would. Oh, sorry. Go ahead.
No, that's okay. No, I just from experience, you bring up a good point with respect to what is, the team doing in the community, but also the educational piece to the patients. I can't tell you enough how, you can have the one TV going, but another TV that's like in a type of loop, if you will, kind of, for the doctor, for the practice to basically, show the patients what an implant is, or what is a full mouth restoration, or what really goes into a crown. But I've also seen a great video of the hygienist within the practice talking about themselves and why periodontal disease is something that needs to be addressed, and educating the patient there too. So I think you bring up a good point in kind of having that loop, if you will, kind of playing in the background.
And there's this interesting psychological thing where it's like me, and I know my craft, but if you put me up on a stage, you get this like bonus of like, oh, he's on a stage, right? I think we've all heard people speak before, and you can kind of sense that. But so same thing, if you put like your team members, your staff up on a TV, it kind of makes them, it elevates them almost even before they've met the hygienist.
Yes.
I would definitely, this one you might not see coming, the logo wall. And that is really in a social media sense, like where you want to be able to leverage social media to grow your practice, right? The best and the fastest growing practices absolutely embrace this. Yes, it's a pain in the butt. Yes, it works. Yes, it's a culture thing. You just kind of have to ingrain it in there. But that logo wall is where, the selfies happen, pictures with the kids, and then your brand is right there. So having that as close to the waiting room or, on the way out, near the front desk, really, really important. Let's see, that's two things. A third one, so we got TVs, we got the logo wall, and then I would say either just having like glass, and if you can get away with it, and light, and having an open space, or something maybe like an iPad bar, something like that, where people can go and fill out their paperwork, or potentially like at JFK, go play games on the iPad and distract themselves.
Right. I also like the charging stations that I've seen pop up in several offices.
I actually, they started doing wireless charging stations, which is awesome.
Oh, that's great.
So you don't have to fumble with or remember to bring a USB cable. It's just kind of like one of those little, like, there's like a little icon on the like on the table that signifies, yes, you can just put your phone down here.
Right.
The only downside is you can't really like plug it in and like use it. You kind of have to not touch your phone and entertain yourself in other ways, which us humans, how much we love our phones.
No, we have to sit on our phones in a waiting room. Otherwise, you make awkward eye contact with people, and we can't have
Sorry.
that.
But you could be like, you could go dual phones though. It's up to you.
Hey, well, it looks like you're gonna have to send me a second phone then, because I only have one.
Yeah. Oh, so these are.
Oh, I was just gonna say, like, hey, jumping back to the configurations and setup. So I was just curious, like, what does the placement, does it signify anything? What does it mean? If the TV is further away, what impression or message is it giving to someone? Whereas instead of one coming like directly in front of me.
Yeah, it definitely has to do with your personal method of how you feel comfortable presenting this information. Again, if you want to kind of have the most intimate experience, it's really going to be like a Surface Pro, like, and you're like literally in the patient's lap. And some people do that.
Doesn't sound very COVID friendly right now.
Probably not. We'll circle back around to that one. You'll actually see in the middle picture, that's Oak Tree Pediatric in Albany, New York. There's a literal like COVID glass screen separating the treatment bays there.
Oh, there is, isn't there? I didn't even notice that.
Yeah.
I can't even imagine how much that cost.
Right.
Does not look cheap. So, if you feel like you have the patient relaxed, reclined, and you want to have this big, impressive demonstration on, let's say, a 50-inch TV, and that TV is on the wall, and you want to, again, we kind of talked about the aspect of you being raised, and it kind of elevating your status as a professional. Posture is a huge thing. and you can accomplish that with the TVs. That is the most common way dental offices are set up. Now you'll see all the way at the right, enamel dentistry. They're a 6-site group in Austin. Dr. Hardik runs that. They did the same thing as Stephanie did in Mid Hill, North Carolina, with the double screens. Thing is, they had a big pane of glass, so that is actually a mount coming down from the ceiling to be able to accommodate that setup. The middle one's a pediatric office, and you'll see that's where we did the screen duplication, right? Those kids are watching Shrek, no matter if they want to or not. They're going to be entertained by Shrek.
I think patients, if I'm talking about from the adult patient's point of view, just having this near me or having the doctor to be able to talk to me about my treatment and diagnoses versus having to turn around and then looking into into a screen, if you will, kind of takes that that workflow, if you will, away. This is more like very intimate, patient-centered, focused type of setup. And I gotta tell you, like, especially if you have a photo, you took an integral, photo of a cracked tooth and really enlarge it, like, yeah, I need to get something done about it, right? So even more so if you got all that stuff in front of you, the screen.
Right. And I don't know about you guys, but if I'm in a chair and the only screen is behind me, I'm like, what are they doing back there? Huh? What are they typing about me? It's like body odor. Don't have them back at the practice. Like, come on. That does happen, not to me, but it does happen. I know that from growing up in a dental practice where I assisted my dad. You're like leaning over a patient and you're literally like vomiting in your mouth.
Well, it's a very intimate setting, right?
It's suction tube. It does come in handy.
So I have another question, and I apologize. It seems like I have a lot of questions these days, but I know we had talked about like streaming services, but what are your thoughts on like sounds? I've seen a lot of practices putting like Sonos in their practices. I've seen them, virtual reality is a thing now where it's the little, what are they called? Oculus? Maybe?
Oculus. Yeah. Welcome to
go.
Nerdland. You can join us. It's fine.
Hey, I just got a Nintendo Switch, so I feel like that was a big step for me.
That's pretty good. I was
Haven't
thinking
made it to
about
the
that.
Oculus side.
Yeah, they added the old N64 games, and that's my generation. So I'm like, should I do it? Anyway, sorry, back to sound. There's lots of ways. So TVs obviously produce sound. You can do the traditional method of in-ceiling speakers. And then you can do what, like, honestly, go out to a restaurant these days and like 8 times out of 10, they just have a Sonos speaker like mounted up high in the corner, and that's like their entire sound system for the restaurant. But in a dental office, we're talking about experience, and going back to the office on the right, one of the coolest ceiling TV displays I've ever been a part of. That was just unbelievable. But what you see in practice, you see that built into the leaf there?
Yeah.
It's very pretty.
Yeah.
Yeah. Dentists are doing some awesome things these days. A lot of these practices are super fun, and the wallpaper stuff that's happening right now in both of these pictures, like, I think people are doing a really good job with the design elements, where like my dad's practice is just in an old house, and that's a dental office, and it's not trying to be anything else besides a dental office. But what you see a patient, so you do and can give them the option to say, watch that ceiling TV entertainment. About 50% are going to say no. I don't know why. We usually don't ask why. We just say, that's fine. We don't have to do that. And in that space, they do want to listen to what they want to listen to. Right now, I would set up some barriers in terms of, death metal maybe is not an option.
Yes.
Scaring the kid next door.
Yeah.
Exactly. Just like
approved playlist.
Approved playlist, right? So maybe it's like, smooth jazz, R&B, country is now pretty like, country's like pop now. You can really just play it in the background. And so what a Sonos allows you to do is, I don't know how many people know this, they actually have a PC and a Mac application, like for computers, not just what you have on your phone. You can still use that. Think of it as like a controller. So you can literally pull up that app right in front of the patient, ask them what they want to listen to, pick from Spotify, Apple, Pandora, Amazon Music, whatever you're subscribing to, and you can play content right through there. And if you do this, set this up right, you can like have one stream playing in like all the common areas, waiting room, hallways, all the areas. And sometimes, pro tip, we put speakers in patient waiting room bathrooms, just so your receptionist does not have to hear the flushing of the toilet 50 times a day.
Mm-hmm.
They will love you for that. Just put it out there. But then let's say you're in your private doctor's office, you can drop a Sonos in there, be a part of the whole streaming service, but you could also be able to part out and listen to what you want to. So you could do the same thing in the treatment room. Let's say you're rocking out in sterilization lab area. I've spent a lot of time in that in my part of my life, sterilizing things. It's nice just to let's just rock out while I'm processing stuff here.
Mm-hmm.
And in terms of streaming services, going back to the TV experience, Netflix, Disney Plus, HBO Max, again, if you give people a lot of choices, it will take a long time for them to settle on one. I think, Nicole, we were talking about this the other day, just about how much time we waste finding something to watch. So think about your patient just sitting there for 10 minutes while you're waiting with a needle to get them numb. You're like, can you choose something already? So less is more here, for sure. And so bring that concept into your practice, where literally when you open up your practice management software, you open up CareStack, the schedule is right there. Our businesses run on time, right? And so each minute, each second that goes away to something that's frivolous like that, yes, entertainment's great, but if it causes you to be 5 minutes behind on every single appointment, maybe that's not so great either.
Yeah, that's what it sounds like. So perhaps maybe sound seems to be more of the best choice in the matter.
Yeah.
And then maybe would it be fair to say for streaming services, probably Netflix, because Netflix has the option for the kids version of it as well, doesn't? Maybe that and Disney Plus. Go with those two. I mean, Netflix is pretty universal, because Ruben, like you're saying, think about it. You could have Netflix, you could have Hulu, Disney Plus, YouTube TV, Apple TV, HBO Max. The list just goes on and on. There are so many streaming services nowadays. I don't even know how to keep track of them anymore. I actually don't even know how many I'm paying.
We've all reverted back to cable TV. It's just we now have all of the channels again. They're just all in different places.
That's
yes.
correct.
Yes, I completely agree with you, Nicole. Pick one service and stick with it. And if you have another one, just have it in your private office. Maybe you want to watch March Madness when it's on, and have it up in your office. That's fine. But yes, less is more.
No, absolutely. And do you have any practices that are using virtual reality right now? Using those Oculuses?
I don't.
Okay. I've never played with them personally. I would just be curious to know how dental practices are using them, or if they're seeing great success with them.
I've seen there's a company called Opera DDS. I apologize if they're a competitor. I don't think they're, anyway, I think it's very scripted though. It's that same style Oculus, or if you've seen the headgear with the phone that clips in, again, it has the two eye holes.
Oh yeah.
I think theirs is more really going to reducing anxiety. Narcos might not reduce my anxiety, but I'm entertained. They're flowing through a beach walk or something like that. I don't doubt that VR is going to be really important though, as the patient experience continues. And these devices have to get smaller. They're pretty bulky still. So maybe dentists are just afraid it's just going to get in the way, or they will have a hard time getting the patient's attention because they can't even make eye contact with them anymore.
Right.
Be like, hey, can you take off the headset?
Yeah.
It's like the entire thing is strapped to their face.
I didn't even think about that part, or like they drop it, break it. Yeah, I guess that'd probably cause some barriers to entry. So maybe just sound and Netflix will be best.
As they're currently constituted, yeah. It's almost like you need like a button on the side of it, so that it's like doctor is waiting for you. And okay, I gotta take them off.
Like a little commercial, the doctor pops up into the screen. Hey, we need you real quick.
Yeah.
That's funny. Well, I mean, next thing is kind of like case acceptance, bringing this back to it.
Mhm.
So like, how does technology from an IT perspective play into case acceptance, whether that's the way the room is set up when you're presenting to a patient? Like you said, some can be more intimate. Let's say if it's a higher dollar value case, should it be a more intimate setting, or should it be, hey, we're sitting across from a table, maybe more like equal business stature? What's best in that situation?
I think you need both. I think a really professional consult room is really important for certain kinds of patients. And especially if it's a very significant financial investment, right? And I think for maybe most of the run of the mill case acceptances, hey, you got a filling, here's your cracked tooth. That the dental chair is probably the best place for that. But going into a private, like treatment rooms are pretty private, but if you go into a consult room, close the door, and you kind of have a more intimate experience. In my opinion, in speaking and working in building these practices of dentists, the consult room is like the big boy room. This is where we talk about the dollars and cents. And it doesn't take away from anything we just talked about the patient feels welcome coming into every single phase of the practice, including the handoff. And I keep talking about the handoff is like the forgotten part of this, where it's like, if you don't do that, you're missing a 6-inch putt here.
You're actually speaking my language there, Ruben, being in the practice myself, starting out as a treatment coordinator and managing a practice. I think it's very important that, that we do talk about if it's like a huge case or even like an implant case or what have you. People don't want to talk about it in front of everybody, especially when there's a lot of money to be involved, and that there's going to be photos to be shown so that the doctor can go over the treatment plan, or the treatment coordinator, if you will, with the patient. I think having that more intimate one-on-one makes the patient feel more comfortable and not have their issues or treatment diagnosis to be kind of like reverberating through the practice walls. But the handoff is so important, with respect to from the front to the back and back to the front again, having that smooth handoff and getting that patient experience to be consistent throughout. It's really important that we keep establishing the trust value of it.
Let me flip it back on you guys here. How do you instruct your clients, the users of your software, to utilize CareStack's features so that the person in the treatment room and the receptionist know exactly what's happening in lockstep?
Well, I'm glad you asked that question. Actually, treatment plans are already done in real time, if you will. So whatever the doctor has diagnosed, somebody's already putting into the treatment plan, so that when the dental assistant is guiding the patient back to the front, let's say if it's being done at the front desk or in a consult room, if you will, the treatment coordinator has it already in front of them as to what type of treatment, the phases, if you will, and of course the investment that the patient has to, they want to know that up front. So all that stuff can be done in real time in the software, where there's not a piece of paper that I'm going to take it, let me go ahead and hand it to Nicole, and Nicole will go over the treatment plan with you. And then all of a sudden Nicole sees it like, oh, okay, I need to go over this with the patient. It's done real time. So it's very smooth with respect to, the handoff, if you will. So it's like they don't miss a beat.
Right. You can do like the Secret Service thing, like approaching the front with the patient.
They can even talk to each other that way. Like,
It's like
I'm taking the patient to the front.
Yeah. Make sure you ask them to schedule the appointment.
Right. There's that internal
Don't
chat
screw it
as
up for
well.
us.
Right. Good question.
Yeah, that's awesome. So again, to kind of, bring it all together here, right? If you have an awesome waiting room, patients impressed when they come in. Technology was already handled ahead of time, and all of their, you know, you don't have to waste any time filling out paperwork or e-forms. There, you bring them back to the chair, they feel comfortable. Maybe you get fancy, and PowerPoint's not very expensive. You do the whole welcome to the practice bit, which is really, again, really impressive thing for a new patient. You make sure they're entertained, and you make sure that everything you've just built up in those first few steps I was talking about is carried through with the handoff, and you schedule the appointment.
That's right. I just love everybody's chat comments, by the way.
Yeah.
Yes.
Ruben, you draw in a very active
This is-
crowd.
Yes.
This is, wow.
You're
all
a
right.
popular guy.
Maybe I
Yes.
should just be a podcast host.
Like you
Move
said,
over
not in
Joe Rogan.
Utah. You're not as popular in Utah, but you're popular everywhere else, I guess. Very popular.
If there's anyone out there who's a dentist from Utah, please call me. I would love to just, you know, I'm OCD. There's a state burning a hole on a map for me, and I'd like to get that taken care of.
No,
Like-
absolutely. So, Ruben, key takeaways that you'd like our audience to kind of walk away from today, knowing or maybe even implementing in their practice, whether they are building from the ground up, or even maybe little things that they can implement if they already have an existing practice. So, like, for example, they probably can't put in a big giant window with all glass at this point if it's existing. Maybe for those who are building one, please do look into that. But what can both parties take away?
Yeah, no, you can renovate your office. You know, really, we're talking about interior design, potentially hire an electrician to get some electrical placed in places so we can have TVs there, because I just don't want to be a part of an install where a cord is hanging down. Like, we mounted the TV, but there's a 6-foot cord hanging down. Like, come on. So, you know, the use of art, the use of really, you know, think of how you feel when you walk into an Apple store, right? It's clean, it's friendly, it's inviting, there's technology. Like, don't you want to feel like that? You know, as a consumer, let's get in the mind of your potential patients. Like, how do you want them to feel when they walk in? So again, circling back to the space in the treatment room, you've got them in the chair, let's say it's an hour. That's a lot of time that they're in your care. And there's a lot of things you can do to make that patient, you know, whether it's the paraffin wax treatment, that's pretty fancy, but a heated blanket, weighted blanket, heated and weighted blanket, the neck pillow, entertainment, whether that's sound, whether that's they'd like to, you know, watch something on Netflix or Netflix Kids. And then making sure the systems and the communication there are there between the clinical and the administrative staff. So everything you built up in those first two things are carried through at the end of it.
No, those are very important takeaways.
Yeah.
We actually have a question right now, and you may or may not have done a white paper or a study on this. And if you haven't, it's always, we would recommend maybe even looking into it. Have you ever tracked maybe like the return on investment for a practice? Let's say, hey, they put X into their practice. Are they acquiring more new patients? Like, have you seen any return on investment, or do you have any studies showing that? If not, that's okay. I know it's kind of out there in that case, but we can always get back to Dr. K, who asked that.
Yeah, no, I would say tracking ROI on like, hey, I just installed a ceiling TV. Am I getting more new patients? Is probably a very tough study to do. I think it is where you do is almost like a before and after, right? If you just put a ceiling TV in one treatment room, I don't know if there's enough data to really measure what's going on. But if you, let's say you bought a practice that, and some of these practices still have no computers, and you implement CareStack in a completely digital workflow, you add patient entertainment options, you embrace social media, you promote the fact that you're a modern, clean practice with patient entertainment options, that destroys versus where you were before that. Okay, you just went, you're almost going from 0 to 100 at that point, right? There are so many things that you were not doing, or, well, in this case, the doctor who was not putting any work into his practice because he was retiring, So specific ROIs, I can tell you KPIs that should be measured, should be new patient in the door, and treatment plan case acceptance should be tracked.
And it sounds like this would play a big role also in maybe on the marketing side as well, because if you are going to renovate your practice and then you start advertising that, you put that on your website, you have photos, you have videos, so people can see, yeah, tracking new patients would be a great metric to take a look at. And then reviews as well. Like nothing speaks more than say like the Mommy and Me Facebook groups, the reviews on Google, Facebook, Yelp, whatever it may be. If you're seeing a large uptick in those, to me, that would be a good return on investment, because word of mouth is going to be the best referral source always. That's going to trump everything.
Correct.
Yep, reviews are paramount. And there's a whole sub conversation about reviews and what number should you be at, right? If you're at a 5.0, is it actually believable? Do people take you seriously? Should you be at a 4.7? What's the sweet spot? That's a whole other conversation. But reviews, that is, you've done your job, you've made the patient happy, you get the review, and that just lives on, right, online. Because so you study consumers these days, especially people in the millennial generation, and even before us. I'm like an elder millennial, I guess. As in, I got Facebook in college. It's like that was very distracting when Facebook came out freshman year in college. But like that review lives on. And when patients are not wanting to talk to anybody, right? Maybe they heard about you from a friend, and the first thing they're going to do is Google you and hope that you don't have 2-star reviews and that they think you're going to hurt them, right? So there's something to be said for making sure you build enough of a tolerance and that you're asking for reviews, and that you build that into the handoff and the workflow, and you just make sure your staff are asking, just like they're asking to book the appointment, because you're not going to please everybody. And at some point, you're going to get a negative review. And you would like that to be, being absorbed by 100 5-star reviews. And that's one of every, right? So I'm not saying it's not going to still ruin your afternoon, because as we take everything personally as business owners, right? But if you've done your job correctly, then it's really not going to change the consumer's view of you and how you run your practice. Just that one crazy patient had a bad experience. There are crazy patients out there. And by the way, there are crazy dentists out there too. I just don't know any of them.
Ruben, I need to ask you a question, only because of the fact that we're talking about, technology, especially when it comes to the, TVs and what have you. I mean, how often, because there's always a new series of TVs that come out. So how often do these things need to be updated?
Honestly, I don't think I've replaced a CRT. We were talking about the TV with seat belt strapped in the corner. Unless, something happens to the TV, or it gets, pixels start burning out, I don't see a real reason to replace them. Mm-hmm. We're coming up on Black Friday and Cyber Monday here in a few weeks. Great time if you guys are getting ready to redesign your practice. And it's still, even if it's a ways out, like you're just going to save yourself hundreds of dollars. And this is what we're telling all of our startups. We actually, unless you tell us to, we don't explicitly sell TVs. We tell clients, this is where to buy them, save a bunch of money. Don't worry about it. Don't overthink it. But really, you buy, let's say on Black Friday, you get a LG 55-inch TV for $299, 7 to 10 years. Like, these are not things you have to replace. They're not like computers. Shouldn't say that.
That's good to hear, because you see every time you go into some, Best Buy or Costco, perhaps,
yeah,
there's something new that's always up and around, and just wondering if that's something that people should consider. But that's great, though. You don't have to. I like the fact that, really think about that Cyber Monday and Black Friday deals for sure, for all our attendees that are starting their practices from the ground up,
Yeah.
or having
Yep.
to update any office that they've acquired recently too.
Mhm.
So we had a lot of those clients as well.
Computers, monitors, tablets. Obviously, CareStack has a very mobile-friendly interface. So if you guys are going to run that on an iPad, no problem. Get some tablets there for those patients that did forget. You guys, curbside check-in still is a thing, right?
We do have some.
Oh, absolutely. Patients
Yeah.
still don't want to wait in the practice if they don't have to. They'd prefer to sit in their cars.
Yeah, so that's a really nice thing. I don't know if everyone on this call knows what we're talking about, but essentially, patient arrives to the practice, it lets you know they're there. You check, they haven't filled out their, I was about to say it again, e-forms. It's going to take a while, and they get a link and they can fill it out in the car right on their mobile device.
Yeah, and let's say they don't want to use it. Cell phones are small. We understand those screens. They could definitely do it on an iPad. Like Ruben said, you could hand them some type of tablet device when they walk in. And they can finalize those forms electronically still. But I wanted to display this information. So if you do have questions for Ruben and his team, his contact information is right there below. There's an email address, there's a phone number for you to reach out and get in touch with them, his website. Definitely reach out. There's contact information for Maria and myself as well. But again, thank you, Maria. Thank you, Ruben, for being here. We really appreciate it. And on our next From the Ground Up, we will be talking about laying the foundation for your practice by Sadie Tamplin, a consultant and a good friend of ours. And we look forward to seeing you all then. Maria, what is it, December 9th?
Yes, it is.
December 9th. So mark your calendars. We'll send out 6 o'clock.
Yep.
6 o'clock on December 9th. We will send out those registrations. Awesome. And we hope to see everyone there.
Hey, guys, thanks for having me. Keep doing what you're doing. And if you want to kill an hour talking about technology, just look me up.